to Somalia, where the health system's under increasing strain after the Trump administration announced funding cuts. They've affected everything from the availability of vaccines to staff and equipment. At the same time, diseases like measles and diphtheria are emerging. The cuts are another blow to Somalians who've endured decades of war.
This hospital ward in Somalia's capital, Mogadishu, is full of diphtheria patients. Doctors are increasingly worried about the spread of this airborne disease. Its symptoms are evident in this ward. Diphtheria is usually preventable through early childhood vaccination, but if left untreated, it can be fatal. Dekwa Mohammed, who fled fighting between government forces and Islamist militants in central Somalia, has already lost one of her 4 children.
Diphtheria claimed the life of one of my children, and another fell ill but fortunately recovered. Now I'm in the hospital with my 2 other children who have contracted diphtheria.
According to Save the Children, cases of infectious diseases like measles and diphtheria have doubled between April and July this year. And aid cuts by the U.S. have led to fewer medical services and a collapse in mobile vaccination programs. The hospital director here says they lack both antibiotics and other medicines to the disease.
The current rate of infection is very high. According to Somalia's epidemiological trends, it shows that there's an outbreak of diphtheria in the last 2 months in 50 districts of the country. Our hospital alone registered diphtheria patients from 49 districts.
With ongoing fighting in several parts of Somalia, getting medical care to people outside the main urban centers is difficult.
Somalia's health financing has for a long time depended on donors. The USAID cut affected the health funds terribly. They used to help Somalia. Many health centers were closed, and mobile vaccination teams that went to remote areas were also cut and no longer function. This has affected our vaccination capacity.
Somalia's health minister says they're hoping to roll out a countrywide vaccination campaign. But with the U.S., its main donor, cutting aid down to 19% of what it was last year, Somalia's youngest citizens might continue bearing the brunt.
Let's pick through some of this with Dr. Quique Bassat, who's a pediatrician and Director General of the Barcelona Institute for Global Health. Welcome to DW, Doctor. Is Somalia alone in seeing an increase in deadly diseases because of cuts in aid funding, or is this part of a broader trend?
Unfortunately, it's part of a broader trend, and this is something that we're witnessing in different countries, particularly in sub-Saharan Africa, precisely because those are the countries that were receiving most of the US aid funding that was helping the operationalization of the delivery of many of those life-saving vaccines.
All right, and this trend you're seeing, this is all down to the withdrawal of US funding rather than more countries, because otherwise it just seems like a massive, the impact of one country withdrawing its aid funding would seem to be disproportionate.
Well, the capacity of the United States to fund humanitarian aid was by far the largest country supporting other countries. Unfortunately, the trend is not only related to the defunding of the US, also other countries are going in a parallel pathway. But because of the magnitude of the funding of the United States, that's where we are seeing most of the effects in most low-income settings like sub-Saharan African countries.
And when major donors like the US withdraw funding, what do you see happening first on the ground?
Well, we see major diseases that are impacting human health increasing, and most of the effect of the direct effect is related to the logistical aspects of dealing with those diseases. Programs that were supported heavily by US funding, for example, are programs related to HIV, malaria, tuberculosis, vaccine implementation. And when this funding is cut, and this funding is cut in a very abrupt way, we are starting to see a very direct impact in the field. And one of the examples are the outbreaks of infectious diseases which are preventable by vaccines and that we are witnessing, outbreaks of diphtheria, outbreaks of measles, which are the direct consequence of interrupting vaccination programs that were working very well and were heavily supported by US funding. When this funding has been cut, we are seeing countries being challenged with the fact of having the vaccines in place in the country, but not being able to deliver them to those who most need it, and therefore that leads to outbreaks. And those outbreaks, unfortunately, carry problems of mortality, because most of those diseases which are preventable by vaccines have a 5-10% mortality rate in those young children that actually have them.
And so is there a risk of the return of diseases that we thought had actually been eradicated?
Yes, of course. We are seeing it with diphtheria. Diphtheria is a disease that is very rare to see in Western countries. We very rarely see it, precisely because of the success of vaccination campaigns that have been introduced many years ago, many decades ago, and that has made these diseases completely disappear. When we are failing to vaccinate the new cohort of newborns that are born with those life-saving vaccines, we will see again the appearance or the re-emergence of diseases like diphtheria or like measles that should no longer be a problem.
And countries with fragile health systems, when a major donor withdraws their support, is that it? Is that just game over, or are there things that they can do?
Of course, this should be seen as an opportunity, and I don't like to use the word opportunity, but this should be seen as an opportunity for Africa's push for self-sufficiency and for some of the countries putting forward internal funding to support this kind of efforts. But for countries that are heavily dependent on humanitarian aid and whose budgets for health are heavily supported by humanitarian aid, the abrupt cutting of this funding leads to this kind of disasters. And unfortunately, there is very little maneuver space for those countries to support their own programs on time for measures to have a positive impact.
Thanks for talking us through that, Dr. Quique Bassat from the Barcelona Institute for Global Health.
Thank you.